of the Department of Economics, University of Mumbai, and the founder member of the first Center for Gender Economics in Asia. She has over 100 publications, including 30 books and monographs. Professor Dewan was the member of the Feminist Economics Group of Engendering of the 11th and 12th five-year plans and is closely associated with training and capacity building related especially to the gender issues. She is also currently president of the Indian Association of Women's Studies. Her research focus is linked primarily to issues and concerns of the marginalized groups and movements. Currently, Professor Ritu Dewan was a conference president of the Indian Society of Labor Economics, which was held in Hyderabad this year. Next, with us, we have Dr. Dipa Sinha, who is a Delhi-based independent researcher and a part of our Delhi Economic Society. She taught at Ambedkar University, Delhi, and also completed a PhD from Jawaharlal Nehru University. Dr. Sinha works on issues related to gender economics, the right to food, social sectors like health and education, and human development. We also have with us Dr. Sona Mitra, who is the principal economist and the director of policy and research at the IWWAGE Delhi. She's also part of the Delhi Economic Society. Dr. Mitra has worked as CBGA, NIPFP, and CWDS as well. She has also completed her PhD from Jawaharlal Nehru University, and her main area of interest is gender economics and policy. I welcome everyone for the panel discussion.
Thank you, Jessica, for the introduction, and to Surjit very much for organizing this event. I didn't know it was the first event of the Delhi Economics Society, so it's a real honor and, of course, a delight.
Second event, ma'am.
Yeah, to part of this. We have with us two. I think earlier, 5 years ago, we used to say upcoming economists, but now I think they've already reached quite a high level. And the kind of work which both Deepa and Sona have been doing for several years is really very, very commendable. Very new, very exciting, and raising many, many different kinds of issues. The theme also, Suriti, I think, which you all have decided is really the central of all debate which is there today. I mean, economics and economic policy and gender. And one cannot exist without the other. I mean, every economic policy has to have gender, and every gender component has to have some finance and economic component within this. So I would like to request now that we start, maybe about 25 minutes each, Sona and Deepa. Then we'll take 15 minutes for discussions, question, answers. Then, of course, your response, and then I'll wrap up after you all finish. So really looking forward to your presentations, both of you. Who's starting first? Deepa, okay.
Okay, I'll go. Thank you, Surajit, and thank you, colleagues at the Delhi Economic Society for organizing this. And we are also quite happy that one of the first topics that you chose is around gender equality, because it's usually comes as an afterthought. Given that it's quite a broad topic, what we thought was that we would I would provide a very broad overview of certain issues, mainly related to unpaid work and unpaid care work, and how that relates to the economy overall. And then Shona will go on in detail in terms of policy and what is lacking there. So if there are people in the, some of the participants work on these issues, this might seem very basic. We apologize for that. Sorry. Yeah. So broadly, just to begin, before getting into the issues, I just thought I would put a list of the sort of things, particularly in India, the research around gender within the economics discipline has been. Labor market outcomes, of course, has been a topic of interest. And there is a lot of study, particularly in the recent past 2-3 decades, with the declining female labor force participation till a few years back and the recent increase. A lot of literature around this, and many economists including feminist economists, have been working around labor market outcomes. A lot of it, like I'll probably get into later as well, has focused more on labor supply issues than on looking at demand for labor from a gendered perspective. Household bargaining and how, again, challenging the whole notion of the household being this neutral space, and is something that many feminist economists have brought up. Women overall in development, gender and development is another area particularly. So this is where even before the last 2 decades, there has been a lot of research, particularly in the social sector, health, nutrition, education, everywhere, where it's more an instrumental view of if women's lives are improved, then children's lives are improved kind of research. And also just as there was a reference to it earlier, the issue of women in leadership and what that means for policy making is another area that economists have been looking at. But the larger issue, I think, it's not just about women being another variable and looking at gender disaggregated data, but what we sort of want to emphasize is also that what Ritu said, that there is no macroeconomics without gender, there is no gender. I mean, these two are really linked, and you cannot really have a complete understanding of the macroeconomy without understanding gender differences, that the macroeconomy itself is not gender neutral, something that many of our pioneering feminist economists have been saying for long, but probably getting greater traction amongst non-feminist economist audience in recent times, still not enough. And when we say it's not gender neutral, it's a lot to do with the role of the unpaid work that women do and how that contributes to the economy, how that contributes to keeping labor cheap, what that sort of the fact that it is not counted in the national income, what that means for our statistics on productivity, for example. All of this is what can be discussed when I say that the macroeconomy is not gender neutral. It is the fact that we ignore women's contribution, whereas it is quite central to keeping the economy going, even what we traditionally understand as the productive economy, and the links between the productive and reproductive not being discussed as part of mainstream economics or part of the main economy is what I am alluding to when I say the macroeconomy is not gender neutral. Therefore, there is a need to look at economies as gendered structures. We need to look at labor markets as gendered structures, households as gendered structures, all markets, in fact, with a gendered lens. And gender is not only a residual, it's not just a dummy variable that you add to your right-hand side, and that doesn't really take care of all the factors that go into it. So like I said, macroeconomic models take reproductive work for granted, but can we imagine what it would be if one did not do so? How would the macroeconomic analysis change? How would our analysis of growth, of wages, of productivity change if we did not take reproductive work for granted? One example is when one looks at impact of, let's say, structural adjustment policies or withdrawal of state spending in certain areas because of fiscal concerns, is the cost that it imposes in the forms of increasing unpaid work burdens on women in the households included in the cost when these policies are being evaluated? Most often not. If we do, then how would one evaluate these policies? So these are just some broad questions I wanted to put in about valuing women's work, recognizing women's unpaid work. And when I say women's unpaid work, not just care work, but all kinds of unpaid work that women do, and I'll show some data later, that these are core issues for any serious study of macroeconomics. What I want to focus on, though, is on this whole aspect of care, and that care as an economic agenda, which again is something that is often seen as something that people who do social work or who work with women and children are interested in, but not as a core economic agenda. So my main concern in the next about 20 minutes is to lay out why care is an economic agenda and how that comes in also when you look at the macroeconomy as not being gender neutral, and care work, of course, is one of the areas which is heavily gendered. What do I mean by care work? Care work is basically essential work. It's work that has to be done I mean, there is a lot of discussion on these terms, on whether one uses social reproduction, one uses care work, what is the difference between these terms. There is a lot of overlap, but there are differences. I'm not going into them right now. The term I choose to use for today is care work, is basically relational in nature. That is taking care of another person, or it could also be taking care of any living being. It could be an animal, it could be a tree. And care, if you really think about it, should be a social responsibility. There is no reason why only women should be involved in care work, although that is how it is in reality, where care is firstly left to the families, and within the families, the division of labor is such that most care work, and here I don't mean only child care, but care, any care of others, being left to women alone, and care of the household, for instance, cooking, washing clothes, all of that. Like I was saying earlier, there is a slightly greater traction to these issues in the mainstream, particularly after the pandemic, which highlighted the importance of care work. Also, with the changing demographics in advanced countries, where with women, more women joining the labor force now, where they have many of these countries have a high proportion of old people. So the issue of elderly care is becoming quite central to their entire policy agenda. And that is one way in which this whole issue of care is sort of coming back in the global north. Although in the global south, it's not exactly the same issue. The burden is much higher, and the burden is, like I said, repeating, not just of care work, but many multitude other forms of unpaid work that women do. So care work consists of direct personal, this is the ILO definition, personal and relational care activities such as feeding a baby, nursing an ill partner, or indirect care activities such as cooking, cleaning, and so on. And within care work also, there could be unpaid care work and paid care work. Unpaid care work is without monetary reward by unpaid carers, usually family members doing it for other members of the family. Paid care work is performed for pay or profit by care workers. So this could be care workers employed by the government or care workers employed by the private sector. There is, of course, a relationship between unpaid care work and labor market outcomes for women in terms of their paid work, as well as unpaid care work and the status of paid care workers. So with the non-recognition of unpaid care work, it keeps the wages low in the labor market for all women, and particularly for women performing care work on a paid basis. Overall, this figure is from the ILO, where you see that on the whole, there are different kinds of models of care work across the world. And you see a relationship that where there is a higher level of employment in the care sector, there is a lower proportion of domestic workers. And also the pattern of that the regions which have the highest levels of employment in the care sector are the regions which we know to have had sort of social welfare models where there is extensive state services available for childcare, elderly care, and so on. Across the world, women perform over 3/4 of the total amount of unpaid care work. This is 3.2 times more than men. And if we, this is again just a figure overall for the world from the ILO report on care work and care jobs, which shows that if you count the unpaid care work and as work, include that and add that to the time spent on paid work, in a day, women actually spent more time working than men do. This is a figure which is now quite commonly used, but it's important to once again highlight because it's a common perception that men work longer hours than women do. That is only the case when we consider only market paid work. But if you include unpaid work, then actually women work longer hours than men do, which also means that women get lesser time for leisure than men do. This is a table that which is estimates based on the time use survey in India. As you all know, the 2019-20 is the first All India time use survey that we have. This is the only data that we have on time use at an All India representative level. And time use is quite important because it captures many activities that women are involved in, which usual labor force surveys do not capture. Because often what even women themselves do not consider the work that they're doing within the household or on the farm as really work that needs to be reported in a survey. Whereas the term time use survey is asking open-ended questions on what men, women, and children were doing in different time slots and putting this together. Basically, what this figure is trying to do is to look at the time use across these four main activities: employment activities, production of goods for own final use, which strictly quite automatically fall into the national income boundaries and understood as productive work, along with unpaid domestic services and unpaid caregiving services for men and women. But for men and women, we are looking for men in the labor force and not in the labor force. Similarly, for women in the labor force and not in the labor force. In all the bars, I just want to highlight this one for women in the labor force and not in the labor force. Basically, that the proportion of women who are involved in unpaid domestic services for household members, so this would involve your cooking, cleaning kind of activities, is extremely high, over 90%, whether the woman is in the labor force or not. The proportion of women spending time on unpaid caregiving is also high compared to men, whether they're in the labor force or not. This seems a little lower because this is for all households. So not all households might have at the current point of time a young child or an elderly person who needs to be taken care of. But overall, the old feminist slogan that all women work is something that comes out quite clearly in this figure, where you see that whether the woman is counted as being in labor force or not, she is doing unpaid domestic services for household members, which we are arguing is also work. Not only are they doing this work, but they're also spending much longer time on this work than men are, whether they are in labor force or not. So again, for instance, women in the labor force spend 239 minutes on average per day in unpaid domestic services. Those who are not in the labor force spend more time, 339 minutes per day. But compared to men, they're spending more than the double the amount of time that men do, whether in or out of labor force, on unpaid domestic services for household members. So in this context, these figures basically bring out not just the uneven distribution of work within the household, which is an important issue, but also a number of issues in terms of the services as well as infrastructure available, which reduces the care burden for households. So there is a requirement, for instance, when we look at unpaid domestic services, what is the kind of services that the state could provide or the market could provide, which would reduce this burden? One can think of piped water, for example, piped cooking gas, or easy access to cooking gas cylinders. Whereas the kind of housing also we saw in this data, for instance, if you have mud walls and mud floors, there is more time taken in household maintenance, just maintenance physically of the house and so on. So if these services are available, better infrastructure is available, the time spent on that work reduces. The other is care services, which is provided by other human beings. So in the form of child care centers, in the form of some kind of mechanisms to take care of the disabled members of the household or elderly members of the household, all of these could reduce the time that women in individual households are spending on providing care and domestic services for the rest of the family. And the fact that this time is reduced also means that time is then made available for women to participate in more gainful employment activities, of course, assuming that those employment activities are available. Not just that, the other economic sort of benefit that one has of expanding care services is that it also has a huge potential in creating direct employment. So this figure, again, from the ILO Care Work and Care Jobs report, is an estimate of how many new jobs can be created if care services are expanded. And just so they make two estimates. One, this bar is where you have an addition of about 152 million jobs. When you expand care services at the level at which they currently are, but to expand the coverage. And then the second kind of estimate is what they call the high road, which is where care services are not just expanded in terms of coverage, but expanded in terms of also the quality of the services that are provided, which is benchmarked to some of the best services across the world. So putting this together, you have over 300 million jobs that can actually be created in the care sector. And this is something that even recently the World Economic Forum has estimated. So even in the context of increasingly technology replacing jobs, you see that this is one sector which is human resource intensive because it is relational in nature. It cannot be, hopefully cannot be replaced by robots taking care of a child or taking care of an older person. And it requires people to be part of this. And once it's recognized as work, it can create employment opportunities. The other thing about care services by their nature is, at least the way it is across the world now, is that these new jobs that they create, a large proportion of them are created for women. That is not to say that only women should do care services, but that is the way it is currently. Also, that a large proportion of them are created in the public sector, which again, relatively could have greater opportunities for better quality of employment for women who are employed in these jobs. So just to try and look at, okay, what does this mean for India if we look at it in the context of India, this whole expanding care services. Just some figures again, that firstly, we know that even in India, there are huge, I mean, the need for different kinds of care services is immense. And I think Sona will talk more about this. But one figure, for instance, is that even going by the existing sanctioned positions in the government, which is not necessarily the desirable ratio. Sometimes it is less than that, but what the government has already sanctioned, there are these huge vacancies and shortfalls. There are an estimated 30 lakh vacancies in centers and state in sanctioned positions. If we look at the public employees, this is of course not just care work, but assuming that a large proportion of public employees are involved in care work, if we expand the definition of care to include healthcare and education and so on, public employees per thousand population in India is quite low. This is data from a few years back. It's 111 in Brazil, 57 in China, and only 16 in India. So the need for expansion in services is quite high. And this is a need, like I said, which if it is fulfilled, has multiple advantages. One is it directly affects human development outcomes. You know that if better services are provided in these sectors, you have better nourished children, you better cared for, lower mortality rates, and so on. Another estimate by Rosa Abraham and all from the Azim Premji University is that if you fill vacancies and invest in infrastructure in the areas of health and education, that can create more than 2 million jobs. And these estimates numbers that I'm giving is only the potential within the government sector. There is also other forms of care services for which there is a demand, and there will be an increasing demand, which could be private provision, employer-employee arrangements. For instance, we have a Maternity Benefits Act in India, which mandates that every establishment which has more than 50 workers must have a creche. If that is really implemented, then there would be so many creche worker positions that would be created. Similarly, which would not necessarily be directly under the government, and so on. So it's basically that expanding care services has huge potential and many benefits. I'm just repeating these. It creates jobs, especially for women, reduces the time poverty of women, making them available for employment. It can contribute to improving human development outcomes, and therefore what mainstream economists are more concerned with, productivity, growth, and so on. It could contribute to reducing inequalities, because a lot of inequality of opportunity sets in with the quality of care that children get in early childhood. And it could also have an overall demand multiplier effect.
Deepa, your voice is breaking.
Okay, I don't know, maybe it's the connection.
Yeah, now it's fine.
I'll just continue. Hopefully it'll be okay. Yeah.
You can
So
switch
if
off
we
your
look at the
video.
workforce participation. Okay.
If you want, that,
Yeah.
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 Yes, please.
So just a few figures on what is the current status of women's workforce participation. We know that the workforce participation rates amongst women, which are the lower two lines, the red and the blue for rural and urban, is much lower than the male labor force participation, workforce participation rates. And again, I'm not getting into issues of estimating women's work. There is a whole area of research there where a lot of exciting new stuff has also been happening. I don't know if Sona will have the time to talk about it, but iWage has also recently done a study on how better to have surveys which will better capture women's employment. Without going into all that, broadly, the headline figures is that the women's workforce participation rates, and here again, when we say work, we are going by the traditional definitions of work, which is productive market-based work. Women's participation is much lower than men. And there was a decline from 2004 to about 17, 18. And this is what has been studied a lot and a lot of literature is on. There is also this recent increase on which there are different claims in various government documents, the economic survey and all that. But when you break this up, what is the main story? And that sort of explains the recent increase as well. That even in this low workforce participation rate of women that we see, a big proportion, almost one third in 2011-12, more than one third in the recent figures, are women who fall into this category of unpaid helpers. So in the NSS, you have the self-employed, the regular, and the casual. The self-employed is further divided into own account workers and unpaid helpers in family enterprises. You see that for women workers, this unpaid helpers in family enterprises is a huge proportion. And even where we are counting women as being employed, the point is that a large number of them are actually not being paid. These would be women, just to help you imagine them, these would be women, for instance, helping out in the family farm, or maybe there is a small shop in the household, or taking care of the livestock and so on, who are counted as being part of the labor force, but are actually not earning any cash income in their name. If we take into account only the paid employment rates, which is how most countries estimate employment, then the women's employment participation actually falls even more. Only about 13% in rural areas and 14% in urban areas. So this whole discussion around the decline and later increase has also to be seen in the context of what is it that women are participating in. And we see that it's mainly in unpaid help sort of work. So women's employment in India is characterized by high self-employment. The location of work, if you look at it, is mostly the home. There are low skill jobs where they're concentrated. Relatively a higher public sector employment. For instance, in rural areas, about 30% of non-agriculture employment is in the public sector. Much of this is in care. So this digression I've made to women's employment, just bringing it back to the care discussion, is also to show that on the supply side, this entire burden of care work that we talked about is also a barrier on women participating in the labor market. And therefore, it sort of restricts the kind of employment that women are able to participate in. So flexible jobs, a number of surveys where you ask women what kind of jobs they would like, they usually say that they would like to work, but they would like the employment to be part-time, flexible, closer to home, and so on. One must relate this to their other unpaid work burdens. Who is currently providing care in India? While we say that the care work should be expanded, I'll just conclude with this in another 3-4 minutes. While we say that the number of care jobs must be expanded, we must also, I think, simultaneously keep berating the point that the quality of the care work also, the quality of the care jobs also needs to be taken care of. Currently, you can look at the care workers within the public sector in sort of this sort of a pyramid, where on top you have those who are in the government employee category, where they're well paid, have retirement benefits, leaves, and so on. Then you have contract workers who are paid similar salaries but don't have many of the benefits. But a large section where actually the number of women workers have been increasing is what I've shaded here, who are honorarium workers, temporary workers, ashas, anganwadis, those who are hired on task-based, like cooks, the various sakhis and mitras under various programs. So while care jobs are indeed expanding, because there is non-recognition of care work and low valuation of care work, you see that even when the government is employing women as care workers, it is not bringing all the benefits that employment would, and particularly employment by the government would bring in, because the quality of these jobs are very poor. And women, even when they are working for pay and working for the state, are not still being recognized fully as workers. And then, of course, you have SHG leaders who are recruited for various tasks who are not paid at all. And then, of course, all this is supported by the unpaid work of women in the bottom. So you have care workers in our country, but they're underpaid and overworked. Most of them are what we call scheme workers. They're not considered employees legally. They're sometimes paid even less than the minimum wages. They have very poor infrastructure for the services they provide and few career prospects. An Anganwadi worker doesn't have very much to look forward to in terms of promotions and growing in her job. Yet there is a preference for such employment. And I want to end with this. Why is that preference there? In another small study that we did across 2 states, where we interviewed about 600 of these workers, we find that despite these poor quality of work, it's actually better pay, particularly in rural areas, compared to any other work that is available for women. The job security is there, although there is no growth, you don't lose your job usually. Relatively greater safety. They talk about social acceptance and dignity when the employer is the government. Mostly predictable timings, although flexible, and or it's usually close to home, and there is some kind of support to travel. Also, not many women articulated this, but you do see it in action, which is that such work also provides opportunities to collectivize. So if you look at some of the most successful, inspiring mobilizations of women workers in the country over the last 10 years, it has been of these scheme workers. So broadly, care is an important issue. It is an economic issue. It has the potential to not only create jobs for care workers, but also allow women to participate in economic activity. But at the same time, and there are jobs which women in rural India today are willing to do. But at the same time, the quality of these jobs are very important to consider when we think about what is the effect they would have at the end of the day on both the economy, on the human development outcomes and so on, as well as the ways in which employment can empower women. So yeah, I'll end here. Thank you.
Thank you, Deepa. That was a huge sweep. I think the kinds of issues which you have taken is, I mean, the fluidity between the kind of care and other kinds of work which are there is, you really did a fantastic, remarkable job. I'll now ask Sona to continue with the discussion.
Thank you.
Sona.
Thank you. Thank you, Ritu. Thank you, Deepa, for that fantastic layout of the presentation. And I don't see much reason for me to get into anything and repeat a lot of the things. It makes my task much easier. So I'm probably not going to take the full 25 minutes and be brief about what I intend to speak here. Thanks to the audience for coming on a holiday. Today is a closed holiday uh, in Delhi. What I want to begin with is where Deepa left, So she actually highlighted the inequalities that operate, especially within the labor market. And why is it important for the economic policies to really become gender inclusive? And how do we do it? I think I'm going to basically talk about. I had thought that I'm going to start by speaking about the entire, the question which actually has made in the last decade has made the policymakers uncomfortable, very, very uncomfortable. And that is the fact that while we see women working all around us, we don't see them in the figures, we don't see them in the numbers. And I don't have a presentation, I'm going to just talk. And the numbers do not really do justice to the women in terms of how they are represented in the statistical framework. So there are two parts to this entire discourse that I want to talk about. One is there are reasons for which women's labor force participation is low, and that is directly related to the factors that drive women's labor force participation, which can be demand side factors and which can be the supply side factors. The government, of course, always loves to talk about the supply side factors, about talking about the gaps in terms of how women are not employable, how there are gaps in their skills, how there are issues with the educational outcomes, how there are issues in terms of not really being able to provide gender friendly or women friendly workplaces, workplace policies, and but the demand side problem of the low female labor force participation is essentially embedded within the entire crisis of employment that India has been facing for more than a decade now, uh, which has been partially recognized but not really recognized officially. Uh, and this employment crisis, which is basically a stagnation of male employment and a decline in women's employment, is driven by the fact that there are not many opportunities for men and women in the economy, more so for women because of the systemic gender inequalities that operate within the economy, especially within the labor market, that Deepa was trying to explain. In our own studies and lots of micro studies and expert and a lot of wide literature available on what drives women's labor force in India or in the world, it is basically uh, um, some of the very important factors that are economic. One of the things being the occupational segregation, that is where women are concentrated. So there are in the economy there are occupations which are female dominated and there are occupations that are male dominated. So for example, and this may sound very basic to many who are here, but female dominated occupations are those which are an extension of the care services that Deepa was talking about, or the care work that Deepa was talking about. For example, nursing, teaching, and all other kind of occupations which involve some amount of caregiving. These are traditional female dominated occupations, whereas a large part of the economy has male dominated occupations, and this occupational segregation is also one of the important driving factors of how the labor market looks like, how the labor market inequalities operate, and how the wages in the labor market operate. Especially because occupational occupations drive the wages, and because women are in specific cohorts in low in these kinds of specific activities or specific occupations, women's wages are somewhere fixed and has been incremental, but not so in terms of how it should have looked like. And therefore, there is a gap between the wage gap between men and women's work. Um, women's wages, and that is the gender wage gap, which is another factor that drives women's labor force participation. So there's occupational segregation driving the wage differentials, which in turn drives the labor market participation rates of women. Um, there is also a big component about how employment is generated. Is it focused to absorb more women into the economy or into the labor market? Or is it a very generic way of increasing employment? Does that help women, especially for an economy when it is going through a crisis where the most labor intensive sector of the economy, that is the manufacturing sector, does not really create a lot of employment? um, and is actually the elasticities of employment, that is the way the manufacturing sector grows and the way in which it absorbs labor into the sector is at one of its lowest in the last probably 25 years. uh, Having said that, so therefore, creating a labor intensive policy which is catering to the needs of women, which is as per the expectations and aspirations of women, where both demand and supply interact in terms of there is job opportunities for women and job opportunities that women would choose to work in. There is a big mismatch, and that's where the problem lies. So there are jobs that are being created which are service delivery options at the very lowest level of the economy. For example, in the newly emerging gig work, the aggregator companies creating jobs as service delivery professionals, or the urban clubs creating jobs for beauty professionals, or the or the other aggregators creating jobs for cab drivers or other certain kinds of service delivery. There is a dearth of job in factory work, where textiles again has been a cohort which was dominated by women. Garments and wearing apparels was a sector in the even within the factory work where women dominated the sector. But we do not really see a growth in those kinds of manufacturing sectors. And therefore, here we are at a situation where the economic policy is not really speaking to employment creation. And that is one of the major reasons for low female labor force participation rate. What does gender inequality does to it? While the systemic inequalities that Deepa was talking about, uh, in which exist in the labor market, it in a crisis situation when there are not much employment being generated in the economy, first it pushes women out of the labor markets. And first, they become unemployed. That is a status where they are actively seeking job but not getting it. And after prolonged search for job, they retreat from the labor force. That is, they are not even seeking. They are the discouraged worker, and they are completely out of the labor force, and they do not even belong to the labor force, and therefore the numbers fall. So therefore, here we are at a situation for women where they have been looking for jobs for decades, for years, and not being able to find one, which has discouraged them to move out of the labor force. And that is called a retreat of women out of the labor force. And the numbers therefore show that women are not employed and women are not actively seeking work. And therefore they are out of the labor force, and the numbers do not reflect. But if we look around, and especially because I come from a cusp of being a researcher and a practitioner, I mean, we get to see what women are doing. They are doing multiple activities in a day, and those activities are a combination of both paid and unpaid work. And here I want to bring in the concept of something that Professor Divan has been talking about for years. It's the continuum of women's work, which begins from which basically overarches the whole paid to unpaid unpaid world of work for women, which includes paid work, underpaid work, uh, unpaid work, and care work of women. And within this continuum, there are women who are doing multiple activities in a day. So, for example, here is a woman who is, and if we look at time diaries of women, which has been done in several private surveys like micro studies, and if we look at the time use survey that was conducted in 2019 by the Government of India, some data that Deepa has shown, we find that for a normal or in a normal day of a woman, the woman is starts her day by basically attending to some domestic chores, attending to childcare, then shifts seamlessly into doing paid work, which is basically trying to work either in the agricultural field or to do some work situated based out of her own home or from her homestead, or if she is a little bit more fortunate, gets to go out to work. And fortunate, I'm saying, because uh, the quality of work may not be good, but then the woman has a place to go for work, which means she also has an income earning uh, component in her daily schedule. And again, comes back and shifts into the unpaid, attending to the unpaid work seamlessly. And that unpaid work includes caring for the children, caring for the sick, caring for the elderly, caring for the community, care that is voluntary caregiving for the communities, and caring for the poultry and livestock, which doesn't get really counted into what women do or recognized as work, and then taking care of the n number of household duties, that is cooking, cleaning, and which includes washing clothes, arranging for water, arranging for food, and also uh, uh, cleaning up the entire home. So, you see, obviously, the length of time that the women spend in working, both combination of paid and unpaid, is much longer than what men do. And the time use surveys and a lot of other surveys, which basically say that women's work days are longer than men, it shows a difference which ranges between 30 minutes to 3 hours. And for me, from the personal and practical experiences, while I believe that that is also an underestimation, because women actually work much more in a day compared to men, if men are not at all contributing to the unpaid household work. In a situation where men contribute to the household work, then the length of women's work days decline. So again, what I'm trying to highlight here is that there are two types of policy making. I'm not going to talk about the policies, but I'm going to talk about the policy making, which is very important, because that is where the framework of policies are discussed, and implementation depends upon how policies are made, that is, how policies are designed. So while there is a whole macroeconomy where the unpaid work needs to be distributed between the state and between the households and between the state and between the women, there is also a kind of nudge among the policymakers about talking and about changing the um, uh, behavioral aspects within the intra-household sharing of workload. Now, these two are very, very different, although extremely interconnected, and are very important when we talk about care. But from the perspective of how to reduce gender inequality in the economy via including women into the economic policies, uh, we start from talking about inclusion of women in the macro, and then we come into the micro. But at the current moment, what we see in the government's entire approach to reducing gender equality, there is a huge emphasis on changing the behavioral aspect or within the household dynamics. That is, there's this whole campaign of share the load, which is basically talking about changing the behavior of the household members, which is the both men and women, giving a nudge towards sharing the workload, which is primarily the unpaid household workload, between the man and the woman, and is taken to be the panacea for removing gender equality. While that is very important, one has to understand the importance of embedding gender into the entire macroeconomic policy. And the question comes is, do we have any holistic policy that addresses gender inequality in labor market? Do we have any holistic policies that address the gaps in care economy, or the care work, or the care roles that women play, which is at the core of inequalities, that operate within the labor markets, uh, for women, against women, creates all the systemic biases against women? Is there a holistic economic policy that clubs the labor market policy, the care policy, uh, the and the education policies, because all of it leads to broader gender inequality in the economy? I would say that it is not. It's actually. I mean, anybody who has looked at the economic policies would say that this is something that has not been there. While India adopted the gender responsive budgeting in 2004-5, which was one of the and Professor Diwan and others have been part of uh, the working group on feminist economics for the Planning Commission, which actually wanted to give this comprehensiveness to remove gender inequality from the economic policies. Uh, that exercise somewhere after the abolition of the Planning Commission has taken a backseat. And what we see here is a very fragmented way of looking at gender inequality, a very fragmented way of looking at policies, and removing gender equality from or including women in each of the policies and give it a stir to make it more gender inclusive. And there is therefore a dearth of comprehensive economic policy that talks to removing the basic systemic inequalities that exist that Deepa was highlighting in her presentation. Uh, Having said that, because I said that I'm going to be brief, what I want to do here is just to focus a lot more on why we need to focus on care and build a policy framework which includes care into the macroeconomic policy framework. Uh, and that is important because care work for women or the unpaid work for women, which includes care work and all other domestic chores that women perform, is one of the lies at the core of the time spent by women in their entire day. Also, it lies at the core of their decision and their ability and capacity to be part of the labor market or not. And therefore, I want to focus on whether we have any policy on care. Honestly, it is a one way it is a win that we have these spaces where we are talking about care, which we did not do at least 10 years ago or 15 years ago. It is one way a win. But the second disappointment is that we do not really have any care policy framework. And this is a work that I'm starting to do right now. And I have been thinking about providing a very life cycle approach to the entire care policy framing. Because that is what happens as an individual is born from birth to the death, that the component of care in his or her life is extremely important, whether the person is a receiver of care or a giver of care or both. And in that, it is very important that the economic policies actually have a holistic way of including care and have a holistic care policy. Right now, what do we have for care for embedding care into the economic policies? Those are the and I'm going to just give you a list of things. If we talk about women's inclusion in economic policies to improve their labor market participation, the first thing that comes to mind is the reservation policy within the MG Narega, which has created some kind of improvement in women's participation in the policy. The National Rural Livelihood Mission, which is also getting extended to the National Urban Livelihood Mission, is now, after many years of its implementation, is all about women. It is about building women's SHGs, creating and strengthening the self-help groups, and it is about empowering women to create their own businesses, to make them financially strengthened, to make them uh, competent to run their own businesses. So basically, making small entrepreneurs out of women so that they can have their livelihoods. What are the others in labor policies? What kind of other policies that exist? There is for the labor market, there is the Prime Minister's Employment Guarantee Program. There are Prime Minister's Kaushal Vikas Yojana, which is basically about skill development. Now, all of these have some amount of reservations for women. Even the Kaushal Vikas has it, the Employment Guarantee has it. But if we look at the data from those programs, we'll find one, that the reservations are not met. Number two, the implementation. Of course, therefore, the implementation is very weak, and therefore we do not get enough number of girls and women enrolled or embedded into those programs. What is the what are the policies for creating incentives in manufacturing sector, which is the most labor intensive sector? Production linked incentive. And this year there was something employment linked incentive, and all of which is actually a burden on the employer, a burden on the owner of the manufacturing unit, and the government do not really have much part to play in it, and therefore the implementation suffers, which in turn has an impact on weak employment generation and therefore practically no employment generation for women. What do we have for the unpaid work? What do we have for what kind of policies do we have for women whose unpaid work is such a big elephant in the room? And what do we have for women's caregiving that they are continuously doing, whether paid or unpaid? We have the healthcare workers. We have health policies. The healthcare workers are at the frontline workers who are implementing those healthcare policies. For example, ensuring that the Janani Suraksha Yojana or the Janani Shishu Suraksha Karyakram, whatever are the programs for improving women's maternal health, women's reproductive and child health, the ASHA workers and the Anganwadi, the ASHA workers are at the forefront to ensure that that is happening. That is getting implemented smoothly. If we are talking about women's child care or caregiving for the children, there are the Anganwadis and the Anganwadi workers and helpers who are actually providing the entire caregiving. If we are thinking about women's entitlements, maternity entitlements, we have the Matru Vandana Yojana, which is a conditional cash transfer policy, which is now embedded within the National Food Security Act. I'm not going to get into the details unless people have questions on that, which is also a compensation for the wage loss that women have during their pregnancy and post-pregnancy. Then we have maternity entitlement as leaves for 26 weeks. Are these getting implemented? These are getting implemented only in bigger and formal organizations. We do not really have much for the unorganized women workers, which form the bulk of women. So, if we are talking about women's unpaid household chores, is the government doing anything to facilitate that? We have been talking about the government to provide continuous piped water supply, continuous electricity to households, provide quality housing facilities with proper functioning watered toilet facilities. We are talking about providing access to clean fuels, because all of this clubbed together saves a lot of time for women, from arranging for water, from spending their time in cooking, from spending their time in going to find out open safe spaces for defecation or toilet purposes. Are we talking about, and when we talk about women's elder caregiving roles, is there a policy? Disappointingly, we do not really have any holistic policy for elder care, because the white paper that was submitted by the government a few years ago actually had family as a central unit for providing elder care within the households. And within the family, we all know that who provides elder care. It is always the women who are doing the elder care services. And therefore, a fallback on family as the primary caregiver for elder care is something which is a travesty for women who want to work, who want to come out of their care roles and want to aspire, want to fulfill their aspirations in their either in earning incomes or in their achieving their professional goals. And finally, we have to talk about, when we talk about care work and policies, community care policies. Every time, and especially in the rural and peri-urban areas, women are very proactive community workers who are the first ones, whether there is a pandemic, whether there's a natural disaster, they are the ones who start the community kitchens, which are unpaid, which actually do not really fall under any purview, any formal purviews. And women are actually giving these services free of cost, voluntarily, and the state doesn't have a role to play. So when we talk about a holistic care policy, there are several components that needs to be included, that needs to be talked about, that needs to be put inside the policy framework. uh, and we have to identify those components of care, give them and give the policies to enable and facilitate the women caregivers, the paid care workers, and also women who want to be a recipient of their care, of that caregiving, so that they can pursue some other profession. And that is the holisticness that I'm talking about, that when we are talking about economic policies to reduce gender equality, it has to be a holistic policy that covers gender equality in all aspects of economy: labor, health, education, and of course, caregiving. And there are also safety. There are also other social sectors which are equally important. And that comprehensiveness is needed, which we are lacking at the present. Just to end by saying that gender responsive budgeting is a tool that has been employed by the government now since 2004-5. It was assumed to be a tool that is going to give this comprehensiveness to policy making, to make gender to put gender into the center stage of economic policy making. But we have seen ups and downs of using the tool, and here we are at a position where we are reinventing the wheel by the government in the last, again, 7 or 8 years, where we are again going back to all the ministries, talking to them about gender responsive budgeting, asking them to again implement their capacity building programs, gender sensitization programs, and make their annual action plans, make their policy designs gender inclusive. So we are starting again for a comprehensive policy. And this cycle goes on. First, there is a boom, then there is a dip, and then there's again a boom. And here, what I want to say is what we need is a holistic, comprehensive gender policy in the economy. And that will not come through ad hoc ways of approaching this policy making. We really need to make use of the gender responsive budgeting tool or any other tool, but we need a comprehensive economic policy that has gender in the center stage. I am going to stop here. Thank you so much. And I'm open to questions.
Thank you so much, Sona. Really an amazing job. Such a comprehensive overview of all the fundamentals and with a vision and a future attached to it, which I think is, very important because we're so used to complaining, but not presenting a kind of an alternative, which is very much there. So we'll take the questions first before I round up the discussion. Are there any questions? Either in the chat or maybe one can just come on screen and say whoever's there.
Ma'am,
Suruchi, are
with
there
your
any
permission, may I request the participants to switch on their videos? It will look nicer now.
Yes, agreed, agreed.
Those who can, please switch on your videos, cameras. Yeah.
Okay,
Mridul
so
ma'am
we
is
have
there.
2 questions. One is by Alok Bachar and by Bamika.
Yeah,
So would
Divya?
Alok or Bamika come?
Yeah. So you want me to read it out?
Yes, please read it out the
If
questions.
they are here, it will be nice if they can ask it themselves.
Yeah.
Bamika's
sure.
here.
Otherwise, Divya, just read it out.
Okay,
Switch on
whatever.
your video and then read it.
Okay, yeah. So the first question is, what are the challenges of implementing gender-sensitive economic policies in developing countries like India, where exist social norms to perform household chores? I think in, I can't read this word, the light work and the heavy work like agriculture, manual labor, etc., assigned for them. Okay, household chores or the light work and the heavy work like agriculture, manual labor, etc., assigned for them. Vamika's question is, India is witnessing an employment crisis. Employment opportunities are scarce and there is higher prevalence of non-standard forms of employment. Is it the case that such employment crisis disproportionately affects women? When overall household incomes are low and stagnating, women face double burden of number one, higher burden to supplement lower household incomes and to engage in precarious low paid work and multiple occupations. Number two, greater burden of unpaid work due to lack of income to avail the services from the market. Yeah, we don't have any more questions right now.
Would either of you like to take up that question? Deepa, Sona, both the questions separately together. Yeah, you
Sona,
got
would
the
you like to
question?
go first? Yeah.
No, you can. I'm just resting. You can, and then I'll come.
Yeah. Uh, the second question first. The first one, I'm not sure. Yes, when employment opportunities are scarce or there are non-standard formats, I think the burden is uneven on women. Like we were saying, any burden of adjustment falls on women more unevenly. And the examples that Vamika has given herself about the greater burden of unpaid work is something that is seen even during COVID. That's something that we saw not just amongst the poorer and lower middle class women, but women across classes, where lifestyles had to adjust to working from home, where the double burden of unpaid work and care work were much more on women from the household, within the household, even though they were in equal kind of jobs otherwise. Thing added to this, kind of relating to what Shona is speaking, is also in terms of policy, that when you have these non-standard forms of work, you find that more women tend to be concentrated in those forms of employment, and the availability of social security is nil, and even I mean, often they don't fall into the definitions of the existing laws for social security. For instance, many of our laws related to social security are apply for workers who are in establishments defined as an enterprise which has 10 or more employees. While there are very few even men working in such establishments, women are really very, very few. So you might have a fantastic Maternity Benefits Act, which gives more than 6 months of paid leave, but less than 5% of women in the labor force actually work in establishments which would fall under the definition of such an act. Similarly, the creches provision is now gender neutral in the sense that it is not linked to the number of women workers in an establishment, but the very few establishments which actually have more than 50 workers to qualify for a creche. So when with this changing nature of work, many of the social protection policies that we demand for and the enabling facilities that one demands for to enable women to participate equally in the labor market, that becomes even more difficult, because who do you put the responsibility on? Same with even, say, sexual harassment. While you have this prevention of sexual harassment, the POSH committees in workplaces, when the woman is a domestic worker in somebody's house, or women who are agricultural farm workers, what is the POSH committee for them? And we do know that women face violence in these work situations as well. So it does, there is a gendered nature to all of this. And as we see greater informalization, these issues become, in terms of policy, also more challenging, I think. The first question, just one line, and I think Shona will take it. I mean, yes, there are challenges. I think that's what her entire presentation was also focusing on implementing gender sensitive economic policy is challenging, because there are very few people who are gender sensitive. And also, I think fewer women in higher policy making spaces makes it less gender sensitive. One example is, say, the gender responsive budgeting itself, which has been sort of reduced to just having a gender budget statement, whereas the idea behind that, and the better people here to speak about it, who actually envisage the whole thing, is for every ministry, every department to go through right from the planning to the implementation budgeting stage on looking at what would it look like if it was gendered. That is something that's not happening at all. I'll just say that much on the first question. Shona.
Yeah, no, I think Deepa has covered it. Just to add to Vamika's question, one little bit that I just wanted to highlight that, when I said that there are these policies of maternity entitlements, these healthcare benefits, and all the childcare provisioning and all of that. Uh, of course, big institutions and big establishments do not have so many women when there are these provisions, but there's also this bit which needs to be highlighted, that there are there are these criterias which has to be met. There are these criterias. If you have these criterias, then you are an establishment which has to follow these number of policies. So, for example, if there are 10 women in an organization, the organization would have to have an internal complaints committee, which is a committee that takes care of any kind of sexual harassment cases or complaints of that. If there are less than 10 women, you do not really have to have that, and the local committee can take care of that. Local committee is a committee that operates from the municipalities or corporations or wherever it is located. Similarly, for childcare provisioning, for creche provisioning in the workplace, for giving maternity entitlement, there are these criterions, and many establishments do not really become bigger because they do not want to take these despite the fact that they aspire to become bigger. They do not become bigger because they have to provide these facilities to the women, which comes as a cost to them. And here is where there's a role of the state to play. The state has to provide incentives in many ways, subsidies and incentives to these employers, to these companies, so that they can retain their women and also recruit more women. And therefore, recruitment policies of companies will have to have some amount of state oversight. And those are missing. So there's one part of recruitment policies, and there's another part of women's entitlement policies in the employment, which you were talking about, and that is completely missing. The question about what are the challenges of implementing gender sensitive economic policies in developing countries, I mean, there are multiple challenges. One is, of course, and you're talking about social norms. So, of course, there are challenges of norms, but norms do change. But what are we doing to change the norms? Are we doing certain things to change the norms? The best example of changing norms has been seen through generating awareness campaigns by the state. India itself has experienced that. Post independence, for the next 20 to 30 years, there has been an advance in women's empowerment or women's agency through several campaigns that we have seen, especially the ones that come to mind is the Sarva Shiksha Abhiyan and the universal education policies, where girls have benefited out of that, and also women's empowerment. But post that, the more we went into embracing policies which were much more outward oriented, outward looking, and we were embracing the retreat of this, the state was embracing a policy where it was retreating. We have seen that these awareness campaigns have retreated, have been reduced. We had one Beti Bachao, Beti Padhao campaign where where we witnessed a lot of awareness generation about increasing girls' education enrollment. But that's a study that we had done, and we have recently published a paper from it in the Journal of Development Studies. And what we saw was, while the awareness was raised for increasing girls' enrollment in schools, there were dearth of schools. There was no infrastructure to actually enroll girls. So there are multiple challenges, both from the norms side, and if norms can be challenged and norms can be molded in a way, do we have required infrastructure? And for that, we need really, and what Deepa said, we really need women in the highest decision-making bodies. And some of the discourses that are there right now about women in leadership, what kind of leadership are we talking about? Where women are not only represented, but their voices are being heard.
Thank you, Shona. There's one more question by Shamoita. I think that's the last question we'll take, because we need to wind up in about 10-15 minutes. So will somebody read it out, or?
Sure, I'll do it.
Ah,
So-
Divya, thank you.
Yeah,
Yeah.
no problem, ma'am. So Shamoita's question is, have we still been able to move on from the situation of women who are only working in household chores throughout the day, basically doing unpaid care work, to women actively participating in the labor force and generating self-income with better work environments?
Who'll take that on? Actually, I think part of that was already discussed in the presentation in a way. But is Shamoita here?
Yeah, can Shamaita explain a little more about what she
Yeah,
means
just
by
expand your question.
moving on from the situation? I'm not clear on that part.
I don't know if she's here. Divya, is she here? Can you see?
I think she's here. Yeah. Could you please unmute Shamoita? Are you there? Yeah. No, that's Alok.
Alok has come now. Alok, your question has already been asked and answered.
Ma'am, may I ask one small question? If time
No,
permits. No.
no, yeah, but
We
let
can't ask, is it? We can't ask.
Shamoita's. Anyway, I don't think she's there. So, Alok, quick question.
It's not there.
Very quick.
Alok, you are muted. You have to unmute yourself.
So basically, in this discussion, it was a very wonderful discussion. So actually, I benefited myself. So basically, my question was like, what are the challenges? So if you can out, you can basically, for example, you can give some examples that like what are the ground level challenges, like if you can name some challenges where you people have some beliefs like men should work outside and the women should work inside in the home. So how can you tackle this belief system, and these are the, so how can you actually tackle this situation?
Should should I answer?
Yeah, yeah.
Yeah. So, no, basically, I know what you're saying. So, you see, it's not only about men should work or women should not work. It is also about women should not travel, women should not go into public transport, women should not commute, women should not wear uniforms where there are designated uniforms in certain types of jobs. There are several those kinds of norms that operate. But, implementing I mean, I don't know what you are trying to ask, because there are two parts to this question. One is with how difficult it is to embed gender into framing policies, and how difficult it is to implement a policy which is already designed in a gender inclusive manner. So there are two parts to this. So I'm not being able to understand which part are you talking about.
Maybe we'll take that up later because we really have a
Yes.
shortage of time. And before I say anything, Ridul Ipan is here from CDS, and I'll be delighted if she would like to add something. She is one of the pioneers of our women and macro groups, and the
Don't waste
kind of
time.
work
Don't
which
waste
we
time. Don't
did
waste time.
together.
Sindu.
No,
Don't waste.
but still I have to say, because the kind of work I think we've all done, particularly that time during the planning commission, was something which we thought would change the world, but anyway,
So
the world hasn't
yeah,
changed us.
yeah.
That's a
It
good thing.
changed a lot of individuals thanks to
So,
that.
so good evening to all. I'm so nice to see all old colleagues here, and it was very interesting hearing all of you all. But what has been, sort of troubling me for quite some time, even when I was in the planning board, how do we operationalize this whole thing of creating employment for women? So should we look at category? I'm not talking about intersectionality at the moment, but supposing we look at women who are already employed. Okay, there's some women already employed, the 25 or 30%. So one is to improve their levels of living and their productivity, their earnings. Then there are these educated women. There are a whole lot of women who are educated, unemployed. So do we look at them differently, that educated women, and then we look at how we can skill them and give them employment? Then there are women not so much educated, but just up to 10th or something like that. So how do we actually do it in a way which does not reinforce existing inequalities? That's what I'm worried about. Supposing we look at them like that, then we are looking at a category of women who are sort of technologically very well educated, and they then will get obviously those employments which give them higher incomes vis-a-vis those at the bottom of the labor market, where they are probably self-employed, but we want to improve their levels of living also. So in what way can we categorize women to be able to operationalize this whole thing of taking advantage of existing technology, growing technologies, and improving the employability of categories of women who are already employed and those who are not employed? So I don't know. It's a very biggish question, but maybe you all can just consider it. I don't think I need an answer immediately, but something which should be worrying us. How do we operationalize this whole issue of creating employment for women? That's mine.
Yeah, Surajit, I think you have your theme now for the next discussion on
Yes.
for the next event that you plan from your Delhi Economic Society, the employability of women and of men without
Yes.
increasing inequalities, but also taking into account, I think, new inequalities which are emerging, particularly on religious grounds, I think, which is very, very much there. The latest PLFS data which points it out. So I think that you can take across genders. And another category, employability of trans persons. I think that's an issue which we never discuss. And the budget doesn't see them as, as human beings anymore. Anyway, we've had a very, very, it's not only enlightening discussion, it's not only enriching, it covered a lot of ground, the discussion which we had today, but also it laid out new grounds. And that's something which I found really quite fascinating. Because when we talk about this whole continuum, the paid, unpaid continuum, it's not just two categories that we are really talking about. It's, and I really don't know whether it's work. I think we have to extend the concept of work to labor. And therefore, it becomes paid, it becomes underpaid. I think that is one category which, we have not done enough research on. And of course, the various kinds of unpaid work, some of them which relate to domestic, but are not only domestic, related to macroeconomic issues. And that is, say, the provision of water, of affordable energy, which is something so very essential. And of course, various other links like that. Transport and infrastructure is another one, very under-researched area which exists. And that there is a care continuum. I mean, this is something I've been working on for the last few months now. And that care continuum supports the work continuum. The paid economy cannot exist unless there is an unpaid economy. It just cannot exist. And because there is an underpaid economy, you have the existence and the continuation of the very precarious conditions of employment which exist. Also, I think when Sona spoke about the supply-demand factors, Deepa laid out exactly the trends, what have been happening in the last 10 to 12 years. I think what is very clear and the link which has been established, though maybe not so many words, is the entire situation of employment, whether men or for women. For women, much worse, but for women, for men, not good either. There's been a stagnation in many sectors. There's been a decline. There's been an increase in informal sector, or what we call the unorganized sector, with worse and worse conditions of employment. And also, let's not forget these 2 or 3 policies which have worsened the situation. One, of course, is that of demonetization. Secondly, is of monetization and privatization, particularly of health and education. I think those are very, very important factors we have to take into account. The pandemic policy, which was, I think, one of the most unsympathetic and had no empathy at all for, a country which consists of 1/3 of migrants, and how because of that, the entire situation has slid back. At the macroeconomic level, and we find this continuously through a budget analysis, I'm not talking only of a gender budget analysis, but that there has been less and less in terms of investment in what we call relevant infrastructures. Highways is not relevant to the majority of the population, certainly not. But also, this focus on capital expenditure. Let's not forget that 38% of capital expenditure in budget goes towards interest payments. So actually the investment is much, much less than what is actually touted about. So there are, I think, many issues which are interlinked to this. The issue of technology. Where is technology increasing? The very, very important aspect of MSMEs, medium and micro small enterprises. And if you see the employment data and the enterprise, you link up the employment and enterprise component, it's the small and micro enterprises which account for 75% of the workforce in the country. So for all the concessions given to the corporate sector, the level of employment or the share of employment which they provide has actually declined. And that is where I think the issue of the state comes in at many fundamental levels in terms of paid employment and also in terms of unpaid care work, whatever terms, and a broader connotation. Because remember, women's work and also men's work, people enter into work not for profit in a country like ours, in a developing country, an eternally developing country. It's been developing for like, I don't know how many decades now. And so you have your income earning, which is very clear, income augmenting economic activities and income saving economic activities, which is where a lot of the unpaid and the care work component comes into being. And if this is so, the resolution does not lie, of course, at a gender norms level. I mean, Alok raised that point and Shona's raised it and Deepa has raised it. Of course, there should be better equality within the household. But the resolution lies in reducing the macro time burden and the care burden which exists. And that can only be done by relevant macroeconomic policies. It's the issue of unpaid or the distribution of unpaid work is not, that the husband will wash 2 clothes and the wife will make 2 rotis. That is not a facile kind of an argument which we are really talking about. It goes much, much deeper than that, and it goes higher than that. It's like, an issue which we have been debating for the last very long, and particularly in the last week or so, the issue of violence at workplace. And the resolution is sought again, you have your what are called a municipality response. You have your CCTV cameras and you have your committees which are never appointed and never function. My university doesn't have an committee for sexual harassment for decades, and we are supposed to be one of the top universities. So if those who are supposed to have it by law, it is mandated, don't have it, you can imagine the kind of institutions which don't. So even when we talk about violence at workplace, please remember this comes at a macro level, that violence has a macro basis. And this is when there is actualization of violence, normalization of violence, by not condemning lynchings, by not condemning bulldozer, by not condemning the other kinds of violence which are taking in other parts of the country. So, these kinds of issues, and also I think we need to relate it to the new labor codes, which have come in different states, which separate violence at workplace from what is going on. They delist a large number of women workers by saying a worker is defined by those who is employed in an enterprise of 5 and more workers, which means all your private employment which exists in private households is totally out of any kind of legislation, social security, whatever, whichever may exist or whichever may not exist. So for me, this has been a very enlightening discussion, a very difficult discussion, which has been put forward in a very simplified, not simplistic, but a very simplified kind of a manner. And I think it's something which you really need to take forward in many different kinds of ways. I have a lot more to say, but that will become an alternate lecture. Thank you so much. Thank you, Surajit.
Thanks a lot, madam. I mean, for your time, for your well wishes for the Delhi Economic Society. I must thank Deepa and Sona also for putting all the hard work and actually making fantastic presentations, many food for thoughts. And thank you, Mridul ma'am, for your comments and all the participants for their questions and participation. And we are deeply grateful to you, ma'am, and for all of, to all of you. We are expressing our deep gratitude on behalf of the Delhi Economic Society. Thanks a lot. Thank you so much.